So I'll be talking about reimagining drying and durability with Brolucizumab. So this is under disclaimer. There's no financial interest involved. So I shifted to Brolucizumab in my practice in the very early days simply because of the durability of the drug. I started initially with difficult situation, non-compliant patients, non-responders. Then I switched to treatment-naive patients and for treatment optimization, and finally to non-CNV indication as well as DME. I'll be sharing some of my cases. So this is the first patient that I tried this drug on. I first saw the patient in September 2020, BCVA 6.9. Now this is a one-eyed patient. He came back to me in April of 21. His BCVA had gone down to finger counting close to face, and he had developed a very large RP rip. So plan was to give loading doses of ranibizumab followed by treat and extend. I gave one injection ranibizumab. Patient comes back after 6 weeks with hardly any response to the drug. Now, seeing no vision gain, I switched the patient directly to Brolucizumab. 4 weeks later, there was significant reduction in the fluid levels. BCVA had improved to 6/60. At 8 weeks post Brolucizumab, all the subretinal fluid and intraretinal fluid had gone away. So he receives another injection at this point in time with a BCA improvement to 6/24. 6 weeks post Brolucizumab, he's all right. He's asked to come back after 4 weeks, but then he comes back at 7 weeks later, where he again has a recurrence. So BCVA had dropped down. At this time, he received his third Brolucizumab injection. So this patient has been under my follow-up for the last 3 years. This is the last OCT before the last injection given. His BCVA is down to 6/36, and he has received around 15 Brolucizumab injections at a frequency of 3 to 4 monthly, but he's still able to manage all his work. The second patient is a 60-year-old female. She came with decreased vision in her left eye, diagnosed as neovascular AMD, already received 3 monthly ranibizumab and 1 aflibercept. Vision was 6/18 with treatment with no further improvement in the anatomical structures. Last injection was given 3 months back. This is the first time when I saw the patient. As you can see, there's a well-defined membrane complex along with subretinal fluid and SHREM. Injection ranibizumab was given to the patient. I called her after 2 weeks. There was some response. There was some decrease in the subretinal fluid. But at 4 weeks, she seemed to have a recurrence. And vision was 6/18 in all these times. So I shifted the patient to Brolucizumab, looking at no response to all previous anti-VEGF agents, including aflibercept. 4 weeks post Brolucizumab, all the subretinal fluid goes away. And this is the first time when the patient has 6/9 vision. However, she again has a recurrence. She receives a second injection. So 2 weeks after Brolucizumab, vision is back to 6/9. 6 weeks, she has a mild recurrence, and the third injection was given at 7 weeks. Again, this patient has been under my follow-up for the last 3 years. This is the last OCT picture. This was taken 1 month back. She has received around 14 Brolucizumab injection over the past 2.5 years. Fortunately for her, the last injection was given in November 23. So she has been more or less disease-free for the past 1 year. She is on a 3 monthly follow-up. And her BCVA is maintained at 6/9. The last patient of this series is a 40-year-old female. She's a working mother. She was diagnosed as pachychoroid with type 1 CNV. Between October 2019 to September of 2021, I had to inject 14 ranibizumab and 2 aflibercept injections, but her BCVA was maintained at 6/9. So this is one of the cases. This is the OCT of the patient showing the CNV and the angiography showing the leakage. So this is September of 20. Yeah, so this is the last time when I saw the patient. Her BCVA was 6/9 and she had a recurrence. This is the time when I switched her to Brolucizumab after discussing that she requires very frequent injections, although the injections were actually working. So she receives 1 injection, then I see her again in December 21, she's fine. Jan 22, she's fine. Feb, March, April, May, June, July, and again she has a recurrence in September. So she was disease-free after getting so many injections for 1 year after 1 injection of Brolucizumab. This is November of 22. This patient came back in September 22. Her BCVA is 6/6 and she has been disease-free for the last 24 months. She's on a 3 monthly follow-up schedule. With this, I'll come to some DME cases. So the first patient is a 60-year-old female, BCVA 6/18 and 6/9 in the right and the left eye. These are the OCT images. The right eye in May 22, BCVA was 618, CMT was 387 microns. She had history of 3 ranibizumab, 1 aflibercept, and 1 ozurdex in the right eye over the last 1 year. Her HbA1c was 6.7. She received 1 injection of brolucizumab. This is July. BCVA is 618, but the CMT has gone down to 330 microns. This is when I gave her the second injection. She comes back in August, BCVA improves to 6 by 12, CMT goes down to 276 microns, and she's kept under observation. Now she comes back after a year, her BCVA is 6 by 12, CMT is down to 287 microns. Again, she's kept under observation. She comes back in December 23, BCVA drops down 1 line, CMT also drops down, and she has developed cataract for which she was operated. Vision again comes back to 6 by 12. This is April 24, CMT is down to 215 microns, BCVA is 6 by 12. Meanwhile, the other eye of the patient, which was 6.9 to begin with and a CMT of 300, it kept on deteriorating. The patient was not willing for treatment. I advised an injection in December 23, but she wasn't willing. Finally, she received 1 brolucizumab in April. And these are the latest OCT images of the patient. As you can see in the right eye, there seems to be no disease whatsoever. BCVA is 6 by 12, CMT of 205 microns, and she has only received 2 brolucizumab injections, the last of which was given in July of 22. The left eye also shows vision improvement, and the CMT is down to 245 microns. The next patient is a 65-year-old lady. She had mild cataract and non-fovea involving DME. BCVA was 6.9. Both eyes good systemic control, and she was kept under observation. Patient lives far away. She came for follow-up after 4 months. She was, and in the meantime, she had a cataract surgery in her left eye, which was performed elsewhere. So this is when the patient came back to me after 4 months. Her vision had dropped down to 6 by 24. She had received 3 monthly ranibizumab, but there was no improvement in her vision. So the first thing for me to do was an angiogram to look for any form of CME, post-cataract CME, but on doing the angiogram, I realized that there were few leaking microaneurysms which were not responding to anti-VEGFs at all. So the plan was to do focal laser followed by brolucizumab, and this is the OCT of the patient. She's been maintaining well for the past 1 year. BCVA is 6 by 9. The next case is a 60-year-old male. Now this is a colleague's father. He had DME in the right eye. BCVA was 6.9. This is March of 24. He received first injection in April of 24 when vision dropped down to 6 by 12. In May, the vision remained same, but the DME decreased, and in June 24, DME decreased further. In August 24, just after 1 injection, the DME seems to have disappeared. Similarly, a 58-year-old female, bilateral DME, poor metabolic control. These are the initial OCT images. She was asked to control her sugar levels and then come back after a month. In between, she went to a different city. She received 3 ranibizumab and 1 aflibercept in each eye. Her HbA1c had come down to 8, but the DME had increased a great amount. So looking at the OCT pictures, I injected ozurdex in both her eyes. 2 months later, the left eye seems to have responded very well, but the right eye did not show that good a response. At 3 months, there was a recurrence in both the eyes. So at this point in time, I gave brolucizumab in both her eyes. This is after 1 month. The right eye again seems not to have responded much. But after 3 months, as you can see, all the fluid has gone away. This is after 6 months of 1 brolucizumab injection, and the patient has now received the second injection in the right eye. The left eye is still under observation. What has been my experience so far? I have used more than 550 vials so far. I've used this drug in all possible indications. This is my first line agent for all approved indications. In my experience, the response in AMD and DME differs markedly. In cases of AMD, I would want to hold till 8 weeks before injecting. And in DME, I would actually wait for 3 months before injecting again and only inject if I can document that there has been a disease recurrence. I have had 1 case of mild intraocular inflammation encountered yet, which was managed with topical steroid drops, and there was no vision loss. So what has been my crux of 4 years? This is the drug, I guess, which gives us the longest longevity, which leads to fewer injections. It decreases the financial burden to the patient and ultimately leads to increased patient compliance. This is a statement. Fine. Thank you.
Thank you, Dr. Tewari.